Why do so many people in the Western world have high blood pressure? Well, it's almost unheard of in populations eating ancient or, non-modern diets. If you eat like most people today, you're probably going to have blood pressure problems. But if you change the way you eat, if you eat like people who don't get high blood pressure or other chronic problems, then you can normalize your own blood pressure. And in today's video, Dr. Peter Rogers is going to explain why. Dr. Rogers is a Stanford and Harvard-trained physician and author of a new book called Prevent and Reverse Hypertension, which we're going to talk about today. There it is. That's the copy. Okay, so if you follow my channel, you know that Dr. Rogers is a brilliant thinker who cuts through confusion with simple, practical advice. And in this new book that he's just written, he lays out how fat and sodium damage your blood vessels, how the potassium to sodium ratio, called the K factor, and this is very important, how it protects you, and why a low-fat, low-sodium whole food vegan diet can reverse high blood pressure entirely, often just in days. So if you've been told that you need meds for life or that your condition is, genetic, and this book can change your life. And I'm going to put a link to the book down in the description. You can check it out. So let's hear from Dr. Rogers. How are people going to keep their blood pressure normal all their lives, Peter? Or if it's already high, how can they get it down?
Yeah, we can learn a lot from the previous experience, like Dr. Kempner, Dr. McDougall, and Nathan Pritikin and whatnot. And I'm going to go through some of the way it all happens, the pathophysiology of high-fat meals and sodium and whatnot.
Perfect.
And
great.
Other things.
Let's get the show on the road. I'm going to bring up your...
This is the sort of like the most recent edition of the Harvard textbook of pathophysiology of heart disease. When I was a young guy, I used to think, Harvard was impressive in the Ivy League. Now that I'm older and I have a lot more experience, I think of all the conventional medicine textbooks in cardiology and internal medicine as a big joke. Okay, you say, well, how could I say they're a joke? Because they always say the same thing about the chronic disease. Let's say hypertension. Here's hypertension. They say that 90 to 95% of hypertension is essential, of unknown cause, idiopathic. You know what idiopathic? It means the doctor's an idiot and the patient's pathetic. They're teaching the same stuff to medical students nowadays. I just talked to one a couple of months ago, as they did back when I was in medical school about 100 years ago, that, nobody knows what causes hypertension. Literally 95% is unknown. Sometimes it's renal artery stenosis or a tumor called a pheochromocytoma. Let me tell you something, that's all BS. Okay. The next thing the chapter say, and this isn't just hypertension, it's for almost every chronic disease. It's associated with aging, seems to be part genetic. It's sometimes due to socioeconomic disparity. Oh, isn't that, but we just don't know. Isn't that thoughtful? Isn't that reasonable? No, it's a bunch of nonsense. Okay. They just want you to take their pill to try to slow it down, match the ill to the pill and send the bill. Okay. I'll explain you why. These books are designed to make sure the patient never gets better. They turn you into a chump, milk you like a cow. That's why I say the Mediterranean diet is the Antichrist diet, because it promises salvation, but it doesn't deliver. Same thing with pills. You can't cure a dietary disease with a pill. What does a pill do? It poisons a metabolic system. You're not going to poison your way to health. It's BS, okay? So the medical system milks you like a cow every day. You got to pay for those medications, keep going for follow-ups. That's the approach of a chump. Okay, what is blood pressure? Blood pressure is, the initial number is systolic. That's a number on top. Diastolic is a number on the bottom. And this means cardiac contractions, like a Greek word. Diastolic means relaxation. Here's a normal pressure, something like 100, systolic over 70. And here'd be a hypertensive patient, something like 200 over 100. The distance between the top number and the bottom number is the pulse pressure, okay? So this is flow, is going to indicate blood flow during systole, contraction, and the lower number is blood flow during diastole, during cardiac relaxation. A baby's born with a blood pressure of about 90 over 60. An ideal blood pressure, we talked about it, is about 110 over 70 or lower if you feel good. We call it normal, you're about 120 over 80 or less if you feel good. Now, it depends. Some people are perfectly healthy, and feel good with a pressure of 90 over 60. However, if somebody started out hypertension and they were to drop down to that same number, they wouldn't feel so good, okay? Pre-hypertension is sometimes labeled here 120 to 139 systolic. Official hypertension, 140 or higher systolic on 3 or more visits to the doctor. Mild hypertension, systolics 140 to 159. Moderate hypertension, systolics over 160. Dr. McDougall would use this typically as his threshold. I've seen him say 160 sometimes. I have heard him sometimes say 150, but and it has to be persistent a couple times, measured at home, so it's for real. Severe hypertension, you start getting systolics over 180, very severe over 200. Anyways, I tell you that as ballpark numbers. One thing that's real important is this concept of a Windkessel. It's like the thing looks like an accordion. You blow air onto the fire, onto the little embers, the kindling to start the fire. And it relates to the ascending thoracic aorta has elastic fibers. When the heart contracts, it pushes the elastic fibers outward. The ascending thoracic aorta becomes wider. Then during cardiac relaxation, diastole, those elastic fibers have elastic recoil. They come inward, and that generates diastolic flow. So you can think of the ascending thoracic aorta as like a second heart. The problem is chronic hypertension for a couple of decades will destroy these fibers. You can't replace them after 20 years of age, and then you lose a lot of your diastolic flow. And this is why as patients get older, they tend to have more systolic hypertension, and they're less likely to have diastolic hypertension. And it's a problem because the coronary arteries fill primarily during diastole. When the heart muscles are contracted, the intramuscular components, branches of these coronary arteries, you can't fill them significantly. So they fill primarily during diastole. So if you have a bigger systolic stroke, you're going to have more prolonged contraction. You're going to have weaker diastolic filling, which increases your risk of myocardial ischemia, lack of adequate blood flow. But the big point, too, I was making here is you're going to have chronic systolic hypertension when you lose these elastic fibers. Most people lose them, and they end up having a chronic problem. This is Dr. McDougall from his lecture when he was talking about the Papua New Guinea Highlanders. Okay, they're eating 93% of their calories from sweet potatoes. It says 90% here, but I've seen in other times papers 93%. Anyways, their carbohydrate was about 95% of their calories. Very tiny, minimal amounts of protein, maybe about 4% of protein, 3.5%, and really low. Okay, so the bottom line is less than 5% on protein, less than 5% on fat, and they were fantastically physically fit, energetic, healthy, skinny. Okay, and that's also why Dr. McDougall had said that he thinks sweet potatoes is probably the healthiest food in the world. I think so too. There's good reasons to say that, because white rice and regular potatoes have only 1% of calories from fat, which is nice, but they both have more protein. Okay, less nutrients. Well, regular potatoes are pretty similar to sweet potatoes. Okay, now here's a classic paper, blood pressure in the African native. Okay, it comes from the Lancet Journal, 1929. Author's name is Donison. In 2 years at native hospitals, these are black men in Kenya, black people in Kenya, over 1,800 patients were admitted. Not a single case of high blood pressure was demonstrated. Zero hypertensive. They measured the average blood pressure of a 60-year-old Kenyan man. It was 105 over 67. For the average European man at the same time, it was 140 over 90. So the average, white guy from Europe was mildly hypertensive. The average African had the same blood pressure as he did like when he was a teenager. Okay, so that makes an important point, because in the United States, like about 80% of blacks would have been hypertensive, all right? But when they're eating their plant-based diet, they don't have any hypertension, zero. So it's not genetic. All that stuff about it being genetic is nonsense. All right, so here's the Tarahumara. They live in northern Mexico near the Copper Canyon, Sierra Madre area. Okay, and they used to be combined with the Pima, but these guys still eat their old plant-based diet with a lot of squash, a lot of corn, a lot of greens, some beans, local greens. Okay, they have virtual absence of hypertension. These guys are famous for running these long races, like 100 miles in 2 days. And it's like every guy can do it in town, not just the fast guy. Okay, and they were combined with the Pima population. The Pima got absorbed into Arizona after the Mexican-American War, 1848, and they eat the SAD diet now. They have a tremendously high incidence of obesity, sickness, diabetes, hypertension, coronary artery disease, all the Western diseases. Tarahumara, they're famous, like I said, for incredible endurance and energy. Nathan Pritikin patterned his diet after them. Another interesting epidemiology population to look at is the Yanomamo or Yanomami. They live in the Amazon jungle at the junction of Venezuela and Brazil. They eat a primarily plant-based diet, and their blood pressure, it doesn't change for life, like 95 over 61. Okay, and some people talk about, well, is stress more important or diet more important? No. Diet is way more important. They've seen that from rationing studies. They've also seen it from the Yanomamo. These guys are a little bit wild and crazy. They're sort of famous for constantly having all these little tribal battles between the local tribes, kidnapping women and stuff like that. But what I'm trying to say is Their blood pressure is fine. So despite the stress of all that, their blood pressure is fine. They checked their urine and they had almost zero sodium in their urine. The point being that the kidney is magnificent at conserving sodium. It's made to conserve sodium, and it's made to excrete potassium, okay? And the fact that it's made to do that makes me think, gee, maybe that's what we're supposed to eat. Of course, that's what we're supposed to eat. So the kidney, it's a masterpiece of sodium conservation. It's not good at conserving potassium because P for potassium, P for plants. It's abundant in plants. Okay, two major categories of atherosclerosis. The first one is typical Western atherosclerosis from high-fat diets. Most importantly, a lot of coronary artery disease, but also pretty good amount of carotid artery disease in the neck, cervical carotid disease. Whereas the more East Asian pattern of diet, sort of Japanese pattern, is those guys eat a low-fat diet with like about 80, 90% of their calories from rice, let's say going back to the 1960s or so, but they smoke like chimneys. And they also put tons of salt on their food, 12 to 14 grams. That's a lot. It's about, more than double what the typical American does. And because of that, they had a tremendous amount of hypertension and they get a lot of strokes. Okay, but they still live pretty long, surprisingly long. So avoiding the high-fat diets is like the most important thing. Here's a brain. This is like typical brain I see every day, real atrophic. Normally the brain should be up tight against the skull here. The white stuff is the skull. This is the brain parenchyma. This stuff here is an expansion of the cerebral spinal fluid, the extra axial space. And this is a typical atrophic brain of a demented patient. You can see the comparison here. Here's a normal brain. When the brain shrinks due to atrophy, due to the loss of brain cells, dead brain cells, the ventricles swell up. These are the cerebral ventricles. And this would be expansion of the extra axial space. The brain parenchyma itself is called the axial space. I tell you that because that's the most important thing I see with dementia. Most important thing by far. I see tons of that every day. Okay, here's a normal brain looking at a coronal as if it were sliced from front to back. These are the three levels of the brain: the basal ganglia, the deep nuclei with all the gray matter nuclei of the individual neurons, brain cells. Here's the coronal radiata at the level of the lateral ventricles. Above that is the centrum semiovale, just sort of like deep white matter. Okay, I put the skull and crossbones here because this is by far the most common location of strokes. I see at least 100 strokes in this area compared to strokes anywhere else. This is the internal carotid artery coming up into the brain. It gives off these branches to the basal ganglia area. These are called lenticulostriate arteries. Okay, then it goes up around the convexity. So these are the convexity arteries. These are the deep penetrating arteries. And the reason why you got a skull and crossbone here is you don't have good collateral circulation to the deep white matter, such that if you have a drop in perfusion from hypotension, you will underperfuse this area, not get enough blood flow there, and you get these little strokes. I see some patients have over 100 of them, okay? If you have really high blood pressure, you'll have a tendency to injure these arteries going into the deep brain parenchyma, the lenticulostriates, and there's several different types of strokes you can get from that. I'll show those. But the key point of all this is that with hypertension, you're damned if you do and damned if you don't. What I mean by that is if your pressure goes too high, you can get injury to these arteries here and get what are called lacunar infarctions, a little hole in the brain. And rare, but you can even get bleeds in these areas. And they happen often enough, little small bleeds, but big bleeds are very rare. I'll explain that in a moment. But what's super common is I think they're overtreating their hypertension. Plus, they get progressive accumulating atherosclerosis in the small arteries of the brain, and they start stroking out their deep white matter. And it's really common. It makes people stupid. This is the Jack Delatorre theory of cognitive decline. He was a PhD guy out of Texas, and he'd tie off the carotid artery in a mouse. And then he would see middle-aged and older mice 2 months later they'd be demented. So he did an autopsy of their brain. He's expecting to see a big stroke on the same side he tied the carotid off, but there was no stroke. It was just a shrunken brain, like that picture I showed you a moment ago. The brain was shrunk on one side. He experimented with it a whole bunch of different ways. Tied off both carotids, tied off the vertebral arteries, tied off the middle cerebral artery, intracranial. Same pattern always. The area that was underperfused just shrunk over time. Loss of brain cells, I think it's due to apoptosis, programmed cell death, which means a gradual cell dying. If a cell dies suddenly, like there's a big clot tossed up to the brain because of atrial fibrillation, that's a sudden stroke. And the brain cells die so suddenly they can't recycle themselves. Their external plasma membrane lyses and all their contents spill into the extracellular space, creates a big mess. It's like, immediate death, necrosis. There's blood on the carpet, okay? It's a big mess, all right? Versus apoptosis is a silent death. It happens gradually. The cell gets recycled, eaten up by the macrophages of the immune system, okay? And so what I'm getting at is this is, I think, a very common cause of dementia. I think this is a major contributor. I think this is a great theory of dementia, by the way. And who gets this? Well, think about it. Lots of people have hypertension. If the hypertension is chronically too high, it damages the arteries, causes atherosclerosis. You're like the mouse. If you overtreat it, you drop the pressure too low with medications, then you underperfuse the brain, you end up like the mouse. Why do you have a blood pressure? To get blood to the top of your brain, your cerebral cortex, okay? Well, you have to pump that blood against gravity. Normal blood's like water. It's pretty easy to pump. But when you eat high-fat meals, the red cells stick together, blood becomes thick. Now you're pumping a milkshake up to your brain. Pressure has to go up. If you eat a lot of dietary sodium, it's a vasoconstrictor, constricts your arteries, narrows their diameter, pumping the blood through a narrow system, pressure has to go up. A lot of people do both. Think about eating a big pizza. All that fat, all that salt, sodium, pumping thick blood through a constricted system. High fructose corn syrup causes increased uric acid in the blood. That's also a vasoconstrictor. Same problem. Psychological stress raises the hormones. Catecholamines, cortisol, that's going to raise your blood pressure. Cortisol's got a little bit of a mineralocorticoid effect to cause you to retain more sodium in your body and to raise your blood volume, raise your blood pressure, okay? The catecholamines are vasoconstrictors, you know, like the concept of sodium was. That's going to raise your pressure. Sleep deprivation does the same thing as psychological stress, and so does caffeine. Those are all things that will contribute to hypertension. Oh, one thing I forgot to mention is I wonder, well, I won't talk about it today because it's a big subject, but I sort of wonder if maybe doing powerlifting increases the risk of hypertension by causing an overstretching in the ascending thoracic aorta elastic virus. That is not proven. That is not proven. I read a little bit to make me think it's probably true, but it's not proven. So I don't want to go down that path at this time. I'm going to read more about that. I'm curious about that myself. Okay, let's see what else. Aortic stenosis, aortic regurg. These are all things that can cause a drop in blood pressure. And as a matter of fact, this guy, Jack Del Torre, he wrote a paper on Ronald Reagan. He thinks this is why Ronald Reagan became demented, that he was hypotensive after his problems when he lost a lot of blood in the early 1980s. And that led to him to develop the vascular hypothesis of dementia. I don't really like the word Alzheimer's because I think it's too fraught with definition problems. People after CABG, coronary artery bypass graft, they're often hypotensive a prolonged amount of time, can get pump head, decreased cognitive function because of that, okay? So what I'm trying to say is this is way more common than people think. Oops, I got to stay back on presenting. All right, another thing is overtreated hypertension the reason people fall? Lots of old people are falling down and hitting their heads all the time. I see a couple head CTs every day. Fell, hit head, BHT, blunt head trauma, okay? Every day, all these old guys. Usually they keep getting, a head CT every 6 months, every 3 months, and then they're dead, okay? It's like a prelude to death. They need to get their act together. What I was basically saying about the blood supply of the brain, it's like a Goldilocks balance. If your pressure is way too high for a prolonged amount of time, you damage the arteries, causing atherosclerosis intracranial. If your pressure is too low, you end up like Del Torre's mouse equivalent, okay? So the best way is just to feed yourself the right stuff and keep your pressure good. I'm going to show you a little bit about brain MRI and brain CT, just so you have a general sense of it. I'm not expecting you to read these, but there's a couple things you should know. Imagine you were talking about zoology. There's plant kingdom and there's animal kingdom. Well, in MRI of the brain, there is T1, and we'll call that plant kingdom, and T2, we'll call that animal kingdom. What you need to know is on T1, fluid is dark, okay? And I remember that the 1 looks like the beginning of a capital letter D for dark. On T2, fluid is bright, and a 2 kind of almost looks like the letter B a little bit, and you can remember that is for bright. Everything in MRI comes down to this principle. A flare is actually what is called a CSF, cerebral spinal fluid suppressed T2. You can see there's a little bit of hyperintensity, a little bit of brightness right here, but the fluid is dark. That's because it's suppressed, all right? And that becomes useful because you can see fluid in the parenchyma much better. And it's not CSF because CSF is suppressed, okay? So these are axial or transverse sections. These are sagittal and coronal. We don't really need to know that so much. But anyways, you need to know the concept of T2 and T1. Here's a typical garden variety stroke. You got a clot in the atrial appendage for atrial fibrillation. It becomes loose, tossed up to the brain, stroke. Okay, middle cerebral artery along the convexity right there. All right, so here would be the look of a typical stroke. It initially is positive on DWI, diffusion-weighted imaging. You got a matching ADC that indicates it's an acute stroke. Okay, flare becomes positive at 6 hours. This is your classic acute right cerebral convexity stroke. You can tell it's the right side because it's almost as if the patient's feet are facing towards you. Okay, this is a right MCA, right middle cerebral artery, frontal lobe convexity stroke, like an AFib embolus. Okay, now when you stroke, there's something called the central infarct core. That is dead brain. It cannot come back. It is gone permanently. But surrounding it, you have something called a penumbra. Penumbra is the gray zone, the twilight zone, and that's sort of it could live or it could die. Okay, it's like, what's that? Schrodinger's cat. You know, it's either alive or dead. What I mean by that is, if the person's able to maintain good blood flow and nutrient flow into the parenchyma, the penumbra, you got a good chance you're going to survive the penumbra. Okay, but if you drop your pressure too low or become prothrombotic for some reason, you can clot off the remaining small collateral vessels here, and the patient can stroke out. Okay, and lose all this additional brain tissue. So we just saw that small convexity stroke, and it would be unusual for it to get this much bigger, but it can get bigger. This would be somebody who lost the penumbra, so to speak. Well, that'd be a lot of penumbra, but you get the point. So this is a big right frontal, parietal, probably temporal too, convexity infarct. The convexity means the outer surface of the brain because it's convex outward. The basal ganglia is deep, like right in here. That's what we'd be talking about there. Okay, now I want to talk a little bit more about specifically hypertensive strokes. So the classic thing that they do is injure these lenticulostriate arteries. If they just cause damage and atherosclerosis occlusion to one of these lenticulostriates, you get a little hole in the brain. The word lacunar means hole. So you get a hole in the brain. Those are super common. I see those every day. I see a couple of them every day, lacunar infarcts. Sometimes they bleed a little bit. Usually it's a small amount. So we would call that hypertensive hemorrhage, hemorrhagic lacunar infarct. Not a big deal. The little ones, I see those a lot as well. And these aren't much worse than these, okay? The little hemorrhage, the key word is little there. All right, here's a classic acute lacunar infarction of the brain in the basal ganglia, anterior thalamus region. And you see a little hole right here. This is a CAT scan. Here it's positive on diffusion-weighted imaging. Diffusion-weighted imaging is unique in the sense that it becomes positive like immediately. As fast as you get the patient on the scanner table, it's going to be positive. Okay, here's a T1 and here's a T2 of a left basal ganglia lacunar infarct. All right, acute lacunar infarct. It's probably acute. All right, but what I want to get at is when you talk about disease, it's important to know the difference between a horse, a zebra, an okapi, and a unicorn, okay? So the old saying in medicine is when you hear when you hear hoofbeats, think of a horse, think of horses, okay? So horses are common diseases. And what I'm trying to tell you is I see atrophy all day long nonstop, okay? I would also say in this category would be lacunar infarcts, okay? They're much less common than atrophy, but they're still common enough. And UBOs is the old name, unidentified bright objects or white matter hyperintensities on flare due to small vessel ischemia. I'll show a picture of that in just a moment. It'll make sense. Now, the next thing that's relatively uncommon, but I see it, are amyloid angiopathy. And that, I think, actually really is most often due to hypertension. But those are small microbleeds. Then I mentioned an okapi. Okapi is this unusual animal that looks like a combination between a zebra and a giraffe. And these animals are really, really rare. Okay, but they are for real. And this is the interparenchymal hemorrhage. I only see a couple of interparenchymal. That means big intracranial brain parenchyma, brain tissue hemorrhages. I only see a couple of these every year. Whereas I see this stuff nonstop all day long, endless. Okay, it's just like almost every single patient. They have hypertension, they're pre-diabetic or diabetic, and they've got atherosclerosis in their heart, their brain, everywhere else. All right, that's like every patient. I don't even look in the chart. I automatically assume they have that. Okay, whereas the other stuff is less common. So these IPHs, everybody talks about them all the time, interparenchymal hemorrhages, but they're rare. And Alzheimer's is kind of a unicorn. When I say Alzheimer's is a unicorn, what I mean by that is there's certainly a genetic type of Alzheimer's, but a lot of what is the so-called sporadic, more common form, I think is nonsense. I think it's just a made-up disease used to get money. And believe me, I've studied that extensively. Books have been written on that subject. We're not going to go into that now. I have a separate lecture here on VegSource where I explain why this whole Alzheimer's business is an exaggerated thing. Okay, so that's a topic for a different day here. Oops, I got to stay on my presenting. All right, so here is an interparenchymal hemorrhage. I call this the okapi, very rare. So here's a basal ganglion hemorrhage on the right side. Again, the feet are towards you when you're looking at these transverse, also called axial sections. And here's a real bad one where it expanded in size, it bled into the ventricle. Now this patient's a pretty high risk to die. Okay, and these are bad hemorrhages. The patient will have a neurologic deficit, likely permanent after these, whereas they often recover almost fully from a small lacunar infarction that's an isolated finding. So anyways, this is a bad thing, but it's super, super rare. I hardly ever see these. Everybody talks about them all the time, but I almost never see them. All right, now this is a severe case of hypertensive hemorrhages, all these little black spots, microbleeds. This is a susceptibility weighted image, SWI. Okay, the peripheral ones are the classic location, the little black dots. This is a multiple black dots differential diagnosis. The central ones are classically attributed to hypertension. I can tell you, I've seen every combination you could imagine of these, and I actually think most of them are related to hypertension. I know amyloid angiopathy is more likely in the elderly related to so-called Alzheimer's, but the patterns I actually see in real life, it mostly looks like hypertension, okay? And now here's what I meant by the horse. Now this is also very common. These are all these bright spots don't belong there. This is a flare sequence image, meaning that fluid is bright, but the cerebral spinal fluid itself has signals suppressed. And it makes you more able to see strokes next to, let's say, the sulci of the brain and next to the ventricles. Anyways, if you counted every little circle here, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, you drive yourself crazy. But you can see, 100, 200 in one patient, little small strokes. And these can be due for intracranial atherosclerosis for the reasons we talked about, hypertensive, smoking cigarettes, diabetes, or they can also be due to overtreated hypertension. You drop your pressure too low, you can get these little white matter strokes, okay? And these we'll call them periventricular flare hyperintensities. They used to call them UBOs, unidentified bright objects, okay? I see these a lot, but I much more commonly see atrophy. Typical demented patient just has a few of these and has a lot of atrophy. Okay, now here's the equivalent appearance on a CT scan. CT scan is not as sort of dramatic as an MRI is, but all this low density stuff, periventricular lucencies, I would describe this as extensive periventricular lucencies, suggestive of small vessel atherosclerotic ischemic disease. Okay, that'd be a typical diagnosis for that. Now here's a normal brain. These are small ventricles. This is totally normal. There's a tiny bit of hyperintensity from the corticospinal tracts, but that's no big deal. Notice that the brain is up and tight against the skull. Not a whole lot of CSF in the extraaxial space. Whereas on this brain, notice that these sulci are much bigger where the fluid goes down into the crevices of the brain, the sulci. The brain parenchyma itself is called the gyrus. Okay, here's the intrahemispheric fissure, a lot of CSF here in comparison with over here. The ventricles are big on this side compared with over here. So that's because of atrophy. So this is ex vacuo. Due to the brain atrophying, cerebral spinal fluid fills the space. You got big ventricles, and you got lots and lots of these periventricular strokes. I see this all the time, every day. This brain looks like, pretty much like an average American 85-year-old, a little worse than average, but about average for an 85-year-old in America. But I can tell you, I've seen plenty of brains in their 50s that look like this, all from people that have all the atherosclerosis risk factors. We call them a vasculopath. Okay, one important point to mention, here's a paper, blood-brain barrier failure as a core mechanism in cerebral small vessel disease and dementia. The point I'm making is, remember I showed you that penumbra diagram that you have dead brain in the center, and then you've got injured brain in the periphery that's poorly perfused. Well, each one of these things, those little bright spots, periventricular white matter hyperintensities, they have a poorly functioning blood-brain barrier. So they are at increased risk to exposure to toxins, and they themselves don't have a very good blood flow. So they're all at risk to expand. They often will expand and become coalescent. So what I'm saying is you should be worried about this. And this is another reason why you don't want to be eating these things like MSG, MFG, manufactured free glutamate, monosodium glutamate, or other toxins. This non-organic food with the glyphosate. That's also an excitotoxin for the brain. These other chemicals like atrazine, that's a mitochondrial inhibitor. There's a whole bunch of toxic things in food like those, succinic dehydrogenase enzyme inhibitors, mold inhibitors they put in all the processed food. Bad, bad, bad. You don't want that stuff, okay? And I'm just telling you, all this brain parenchyma is at risk because it's got a weak, leaky blood-brain barrier. Not good. So this is a good paper. Okay, and this is what I meant by the baseline intracranial atherosclerosis. By the way, my book, this is written for the average patient to teach them how to cure themselves of hypertension. It's relatively simple. I consider this like a baby book compared to my other 700-page books. This stuff, this lecture is more advanced. Okay, I'm giving a more advanced lecture because I think it's more fun, it's more interesting. And if any of my doctor buddies want to try to refute what I'm saying here, I'm going to make it very difficult for them to do that. Okay, but the book itself is not going to go into this extensive detail. Okay, this is too much, I realize, for an average person who doesn't have an interest in pathophysiology. Okay, so here's a typical normal capillary in the brain. The red blood cells are flowing through the capillary in this direction. The yellow is the capillary basement membrane. The green are like the vascular smooth muscle cells, or the pericytes as we call them in the brain. The blue circles are the oxygen being delivered from the red blood cell to the neuron, the brain cell here. Okay, so what happens when you got diabetes? Well, you get thickening of the capillary basement membrane, glycation of the capillary basement membrane. As it becomes thicker, that's greater distance that the oxygen has to travel to reach the neuron. You get hypertrophy of the vascular smooth muscles. You can get, some proliferation of them. All of these things, you can also get laying down of collagen in this region. Cause increased distance for this oxygen to travel, less oxygen getting to the brain tissue. You superimpose upon that a high-fat meal and vasoconstriction from a high-sodium meal and a high uric acid meal from high fructose corn syrup, for example, you're going to be getting less and less oxygen to this brain cell. If you drop that oxygen delivery too low, you can start losing brain cells, going into atrophy, mouse equivalent, cognitive decline around the corner, okay? Normal endothelial cells, arterial lining cells, are kind of spindle-shaped along the long axis of the direction of flow, and they sense the flow direction, and they like laminar flow. They produce nitric oxide. It's the most important thing they make. It's a vasodilator. Dr. Caldwell-Esselstyn talks about this all the time. Endothelial nitric oxide. It's a gas, diffuses into the lumen of the blood vessel and inhibits the platelets, prevents them from clotting. It then diffuses into the wall of the artery, and it causes the smooth muscle cells to relax. So that's what you need to know. Nitric oxide is a gas. It goes into the lumen, prevents clotting, goes into the wall, and relaxes the muscle to cause vasodilation, because the muscles wrap around the artery. So if the muscle constricts, it tightens up the artery. So nitric oxide loosens the artery. So here's a normal artery. This is the flow in the lumen of the artery. This is vasoconstriction, where the artery vascular smooth muscles are contracted and flow shrinks. So instead of being big, flow gets small, okay? This would be vasodilation, where the flow gets bigger than this. Anyways, what can do this, all right? You can get this as a consequence typically in the setting of hypertension. You can get it from certain drugs, we'll call this. Cold temperature increases alike of this, being stressed out, sleep deprived, caffeine, okay? If you're sedentary, the arteries are smaller in diameter because they don't need to deliver as much blood flow, okay? Exercising opens up arteries. Nitric oxide opens them up. Getting some sunshine opens them up. Potassium and magnesium are the big vasodilator, and the plant nitrates as precursors to nitric oxide. Staying warm opens up arteries. Okay, dietary fat. It'll inhibit the mitochondria in the region of coenzyme Q and complex 3, all right? And that starts the whole cascade problem of diabetes, insulin resistance, especially saturated fat. There's other things that inhibit this inner mitochondria. You need your mitochondria because they make 90% of your energy, your ATP that the cell uses. It's like a $20 bill in a cell, this ATP, all right? And also, my advice after studying longevity, aging, and health a lot is you want to exercise. You want to make sure you do at least a moderate amount of walking every day and do something vigorous at least a couple times a week. It doesn't have to be for a long time. It could be for 10 minutes, but do something. Go up the stairs, do something, because your body is sort of a user-loser system. And if you don't exercise to challenge your mitochondria once in a while, you're just going to keep losing them, and your body's not going to maintain them as well as you would like. Okay. And so then I might have shared this with you before, but basically I knew that mitochondrial injury was a major problem in aging. I knew it was a problem and the cause of diabetes, insulin resistance. So I asked myself, well, what else does this? I need to understand this better. I went through all my biochemistry books. I own like 7 of them. Nothing in my nutrition, biochem, college, med school, etc. So then I started going through the papers. I real quickly found 10, 20, 30, 40, 50, 60, 70 mitochondrial inhibitors. Okay, and then some, and there's actually more. There's probably more like 100, but I found 70 real quick. And people say, well, are they common? Let me ask you something. Tell me if you ever heard of these things. You ever heard of statins that inhibit coenzyme Q? You ever heard of metformin that inhibits complex 1? You ever heard of atrazine sprayed on the non-organic corn? You ever heard of glyphosate that's sprayed on the non-organic soy? Glyphosate's also sprayed on 70 other things. I have a paper showing that it's sprayed on 70 different foods, and probably more than that. That's 70 that were included in the paper. Antifungals, they put antifungals, which means anti-mold, in all the processed food and all the fast food because they don't want it growing mold that gets returned to the place. Those inhibit succinate dehydrogenase, an essential enzyme and intermitochondrial membrane electron transport. When that thing backs up, succinate accumulates. That's the substrate for the reaction. It travels into the cytoplasm, into the extracellular space, and it activates a whole hypoxia pathway, because the main reason it would normally accumulate would be hypoxia related to an infection in our ancestors. But in the modern people, it often is inhibited by these chemicals we ingest. okay? And then you get this whole ischemic pseudohypoxia thing going on, which is like analogous, similar to cancer metabolism. Not good. You don't want that. So anyways, I'm making the point is, this is why you want to eat these healthy, low-fat vegan diets, organic only, starch-based, to avoid a lot of this stuff, okay? Omega-6 cooking oils produce toxic aldehydes like hydroxynonenal, inhibits the ATP, because you need ATP energy to pump calcium out of the cytoplasm, and calcium is what's activating the muscles to contract, the vascular smooth muscles to contract and give you hypertension. So unless you've got good ATP production, you're going to have a hard time getting that under control. And it's also the same concept in brain excitotoxicity, to prevent your brain cells from becoming overactivated. I think that's why a lot of those paleo keto carnivores are so sort of rude and impulsive in their behavior, because they don't have good mitochondrial function in their brains. Okay, and then here's the Peter Rogers, MD, my theory of dementia. We talked about the Jack Delatorre theory, that if you don't get enough blood flow to the brain, you underperfuse it, hypoperfusion theory of dementia. But what I would say is, you got a baseline metabolic rate in a brain cell, you got a baseline oxygen glucose delivery. So this would be, if you drop the oxygen glucose delivery, now you got a gap, and this cell could potentially go into apoptosis. But I took this a lot further. You can also increase the metabolic rate in this neuron if you are stressed out, you're drinking caffeine, you're sleep deprived, you're smoking cigarettes, you're taking amphetamines like the medicines for attention deficit, glyphosate's an excitotoxin, beta amyloid protein is an excitotoxin, like if you have insulin resistance from a high-fat diet, okay, MSG, manufacturer-free glutamate, aspartame, these are all excitotoxins increasing the metabolic rate, so they increase the likelihood that this gap gets wide enough that the brain cell is going to fail, it's going to die, it's going to go into programmed cell death. That's called apoptosis, a gradual death where it recycles itself. And on top of this, you now throw in a third variable, all these mitochondrial inhibitors, and I just showed you about 60 of them on that diagram, and they're common, and it includes marijuana, okay? Marijuana makes people stupid, okay? So there's nothing good about it, so don't listen to anybody who tries to tell you. They're an idiot, okay? I deal with the neurologists. I got a bunch of neurologist friends. Marijuana causes brain damage, okay? So anyways, if you impair your mitochondrial function, now you're really headed for trouble, because you can't make the ATP to pump out the calcium. So this gap widens, okay? It's like not having enough energy delivery, oxygen glucose delivery. So I see this all the time. I see tons of brain damage. What I'm trying to say is, this is what you should be afraid of. Don't be afraid of that big bleed I showed you in the brain. I almost never see that. Twice a year I'll see an interparenchymal hemorrhage, okay? And that's like dying from a shark attack. Yes, sharks are scary, okay? You don't want to mess with a shark. But how many people die from shark attacks? People die and become demented all day long, nonstop, endless, from hypertension, diabetes, and atherosclerosis, okay? This is what I see, shrunken brain after shrunken brain after shrunken brain, for all the reasons I'm just telling you. The Jack Delatorre theory, and then my theory of the neurons, I call it supply and demand theory. If they cannot meet their metabolic demands, they die, okay? And the way you meet your metabolic demands is you maintain good blood flow and you don't overstimulate the neuron, and you maintain good mitochondrial function. And that's why I meant you should exercise, so you keep a high level of mitochondrial function. And when you run, you don't just activate the mitochondria in your muscles, you activate them in your brain. There's been studies showing that exercise increases mitochondrial biogenesis, the production of new mitochondria in the brain. It improves their function, because exercise and movement, they go hand to hand. I mean, why do you think you have a brain? Your brain is so you can walk down a path in a forest, a jungle, or a prairie and survive, okay? And then Voltaire's question, why do animals have brains but plants do not? It's because an animal moves, okay? As soon as you move, you have to make a value judgment. I shall go towards the fruit tree over here to get something to eat. I shall avoid that location over there because there's a bunch of coyotes over there and I don't want trouble, okay? And then you have to navigate, you have to avoid obstacles, you have to have a memory to know how you get back where you came from. So I'm saying is movement causes a lot of your brain. Most of your brain's dedicated to vision, seeing things, and then moving, okay? And then also, making value judgments on what to do. Okay, here is the Dr. McDougall video on blood flow. As a matter of fact, I don't know, Jeff, are you able to show this to the audience?
Yes, I am. Let me pull it up real quick here. Here it is. You want to tell us what we're seeing, Peter?
Yeah. Okay, let me see if I can see it. The key thing is that the red blood cells initially are flowing free and independent of each other. They have a negative charge on their outer surface called the zeta potential, and all of them are negatively charged, so they repel each other, which is good. You don't want them to stick together, okay? The endothelial lining has a zeta potential negative charge, but now after the meal, after the high-fat meal, this is blood sludge, also sometimes called rouleau formation, a stack of coins in French, and as they stick together, then you're going to have a drop in the oxygen delivery to the tissues. Your PO2, pressure of oxygen, drops about 15 to 20% according to Peter Quo. Roy Swank once measured 30% drop in the blood flow and the oxygen delivery to a hamster brain. Okay, so not good. This is why you feel sluggish after you go to a greasy spoon. These red blood cells are sticking together and they're not delivering oxygen well. And then it's going to take you a variable number of hours, depending on the type of fat, before you get good blood flow again. Okay, so that's a 50-second long video. It's available at Dr. McDougall's YouTube channel, Dr. McDougall Health and Medical Center. It's well worth watching. It's well worth showing to your friends because it helps them to understand what's happening. You don't want that. It happens with saturated fat, and the researcher Roy Swank, the neurologist who worked with Dr. McDougall, emphasized the role of saturated fat. The chylomicrons will increase it. That's the initial absorption of fat from the intestinal tract, from the gut. Okay. Gregory Sloop showed that it's also a major effect of LDL cholesterol elevation. LDL cholesterol was more strongly correlated with blood viscosity than was total cholesterol. It's a bridging molecule, sticks the red blood cells together, overcomes the zeta potential. I'll show you pictures of the zeta potential stuff in just a moment here. Triglycerides, they also stick the red blood cells together. The bottom line is fat sticks red blood cells together, and it raises blood pressure, okay, and it also causes insulin resistance. Now, here's the work of Peter Quo. He was a cardiologist in Pennsylvania in the 1950s, and he fed patients high-fat meals. And these are coronary artery disease patients with cardiac angina, chest pain related to coronary artery disease. And he would then check their blood lipid levels every 30 minutes. And at peak lipidemia, peak fat in the blood, they would routinely get chest pain. Okay, kind of a dangerous thing to do. You'd never get that study approved nowadays through IRB and internal review board, because you can kill the patient. Okay, but they didn't have any angioplasty or stenting back in those days. Anyways, so that's what he found with saturated fat, and that kind of corresponded to the research of Ansel Keys. They later retested it with unsaturated fat, PUFAs, polyunsaturated fatty acids like omega-6 cooking oils, and they found the same thing. The omega-6 cooking oils even caused more prolonged blood sludging than did the saturated fat. Not good. This green line down here at the bottom is the carbohydrate meal without any fat. It didn't cause blood sludging at all. Do you understand that? At all. And that's why carbohydrate is better for us. That's a major reason. So you avoid the hypertensive effect. This causes hypertension, okay? Thick blood, pumping a milkshake to the brain, you got to pump at a higher pressure. Okay, here's a zeta potential, a negative charge on the outer surface of a red blood cell. And they all have it, so they repel each other. A molecule that is positively charged in a big enough size will stick the red cells together, and that's called a bridging molecule. LDL cholesterol, triglycerides, chylomicrons, they all do it. PUFAs, they do it. Especially omega-6 PUFAs. Okay, IgM antibodies, acute infection antibodies, fibrinogen, the clotting protein, uric acid that can be increased, for example, by eating lots of meat, also increased by eating a lot of high fructose corn syrup. Okay, LDL cholesterol, the higher the LDL cholesterol, the higher the blood viscosity. The more thick it is, the stickier the blood. Okay. The endothelial cells also have a negative charge around them. The white blood cells have this negative charge around them, so they don't stick together. You don't want them sticking together. In the movies, people die from a gunshot wound and there's blood all over the place. Okay, but in real life, a clot in the heart, that's a heart attack. A clot in the brain, that's a stroke. Okay, and cancer very often is caused due smaller clots and tissue scarring causing ischemia, lack of blood supply to the tissue, where it switches into anaerobic-like metabolism, a Warburg effect, so to speak. Okay, here's a typical endothelium. You'll have a core protein in the plasma membrane. It's attached to what are called glycosaminoglycans. Usually it's a disaccharide, a sugar with repeating units, whereby they're very negatively charged from the sulfates especially. They've got little sialic acids at the end of them. That's like the immune system identification card. They got cholesterol sulfates in here to give them a negative charge. Water lines up along them with a dipole partial charge, and it makes them slippery when wet. So the positive charge of the hydrogens lines up with the negative charge of the sulfates, and the oxygen has a negative dipole on it. Dipole means partial charge. So slippery when wet, and that helps the red blood cells to slide through the capillary. Same thing with the white blood cells. All right. So normal red blood cells about 7 microns. You want to remember that. That's important. About 7 microns in diameter. Normal capillary is about 5 microns in diameter. Okay. The bridging molecule sticks them together. Now you're trying to push this big bulky thing, like we just saw with that video, through these capillaries. Pressure has to go up. Okay. We talked about how lack of dietary fiber causes abdominal pressure syndrome, the work of Dennis Burkitt, but lack of dietary fiber causes another problem, even bigger or worse problem. You need dietary fiber to make tight junctions. Dietary fiber is taken by the good bacteria of the gut. They got smiley faces here. They convert it into short-chain fatty acid, in particular butyrate. Butyrate's used by the gut lining cells and enterocytes to make tight junctions so that nothing bad can get across this line. It's a single cell thick. If you don't have the fiber, you can't make the tight junctions, and then you get leaky gut. Increased intestinal permeability is what leaky gut means. And then bacterial toxins like LPS from gram-negative bacteria, they can get across this lining, get into the subepithelial space. They can get into the blood. They cause a lot of problems, and they cause clotting too. They make the blood more predisposed to clot, and that increases blood viscosity, makes the blood thicker. They also cause autoimmune disease to a whole bunch of other things. But gram-negative bacteria, their endotoxins LPS, lipopolysaccharide. Gram-positive bacteria, their endotoxins LTA, lipoteichoic acid. If you have an excessive amount of free iron, like there's excessive free iron in processed foods because they tend to iron fortify them, or if you eat a lot of red meat, for example, that's high in iron. Heme iron from meat is more absorbed than is plant iron. When men tend to become iron overloaded in Western countries in their 20s. Women, postmenopausal, like after 55 years of age or so, when they stop menstruating. And free iron, normally iron's like a fire. It's good in your house. It's like Ed Weinberg is the first person who said this. It's good in your house, in your stove. It's good in your house, in your furnace. But you don't want fire anywhere else. It burns things down. And that's what it does in the blood. It cycles back and forth. It's called ferrous redox cycling between Fe2 plus Fe3 plus, and it hands off electrons to fibrinogen, the clotting protein, and it causes deformity of its shape. Normally, it's shaped like a slinky, the clotting protein, fibrinogen, but it'll change the secondary protein structure from alpha helix, which is like a slinky, a cylinder, to being flat, beta-pleated sheet. And then they'll stick together and they'll stack up. The bigger a molecule gets in aqueous solution, in a water-like solution, the more likely it is to precipitate. To precipitate in the blood is to clot, okay? So you form these amyloid clots, and these are a big problem. Viral infections can also cause amyloid clotting. You don't want this happening, okay? So how do you avoid this? You prevent leaky gut, and you don't become iron overloaded, okay? As a matter of fact, when I go to get a blood test, I'll say, pull off a couple extra tubes, because I don't like to donate a whole unit at a time. You could do that because I feel like I might get lightheaded or feel tired or weak. But I just say, go ahead, pull off a couple tubes, like 3-4 tubes. Okay, now when you eat the meat diets, you tend to get more systemic inflammation, and that raises your white blood cell counts. Meat eaters, have a significantly higher white blood cell count than vegans, low-fat vegans. And typical white blood cell, the most common one is a neutrophil. It's about 65% of the white blood cells in your blood, and it's double the size of a red blood cell. It's about 14 microns in diameter. So this is a typical neutrophil here. It's also called, polymorphonuclear leukocyte. Okay, it's got a segmented nucleus, so it can slide between the endothelial cells for diapedesis. But anyways, the point I make is that you got to push these big honking cells, twice as big as a red cell, through your capillary. 14 micron diameter cell through a 5 micron capillary. Pressure has to go up when you elevate your white blood cell count for that purpose. Okay, the inflammation from the fat. It's associated, high-fat meals, causing some of these cells to degranulate. They release a chemical called myeloperoxidase, MPO, and that will have a tendency to injure the glycocalyx in the body. That can cause adhesion, sticking of white blood cells to the arterial lining cells. That can be the initiator for clot formation. It's a variable severity, but I'm just telling you, there's things happening in your blood that you don't want after you eat a lot of meat. You can even get full activation of neutrophils where they release their internal contents. That's called netosis, neutrophil extracellular trap. They throw their DNA they commit suicide, and they throw their DNA into the extracellular space. It's got histone proteins attached to it that are real prothrombotic. And they'll do this to trap a bacteria. Like let's say they're trying to phagocytize a bacteria and they can't get their mouth around it. It's partially hidden, attached to something. They'll just throw their net on top of it. And here's a paper to this effect. Netosis drives blood pressure elevation and vascular dysfunction and hypertension. So what I'm saying, you heard Dr. McDougall, he has a good lecture on the subject. He says it is the eating meat that is the main dietary cause of inflammation in the human body. Okay, there's tons of papers to that effect. Because everybody's always thinking about gluten. Oh, gluten's the end of the world, blah, blah, blah. And McDougall's like, meat's a much bigger problem than gluten, okay? So there's some people, they're gluten sensitive. I realize there's special cases. We're not going to get into all that right now. But what I'm saying is you don't want these problems for no reason. It's like, why give yourself a problem for no reason? Here's a whole bunch of things that make blood thick. And the reason I'm going through this is, number one, what is atherosclerosis? Atherosclerosis is a blood clot. Anything that predisposes the blood to clotting will increase atherosclerosis. Number two, things that predispose the blood to clotting make the blood thicker So they're going to have a tendency to raise your blood pressure, okay? Blood is a non-Newtonian fluid. A Newtonian fluid is like water. If you leave a cup on a table, it's the same as if you pour the water. It doesn't change when it's in motion to when it's not in motion. But blood is not. Blood is thixotropic, meaning that while it's flowing, it's relatively liquefied, okay? It has lower viscosity. When it sits, it starts to aggregate. It starts to clot, okay? So you don't want that. That's another reason why being sedentary at an excessive amount is also bad. If you have to sit at a desk all day, stand up when you answer a phone call. You know, when you have to go to the bathroom, go walk to the far bathroom. Do some isometric exercises. When you get a little break, walk around your room. You know, I walk around my office like an animal in a cage, okay? I'm like a big lion in a little cage. And I get a free moment, I'm going to run and go up some stairs. You know, I'll bolt up and down 10 flights of stairs or 20 of them. I want to keep myself moving. I want my mitochondria active. Use it or lose it. You lose the physical ability to do something if you don't maintain it and keep doing it. Normal blood flow equals laminar, meaning the red blood cells are in the center, then the white blood cells, and then the plasma on the outer surface. This is how it's supposed to be. It sort of has a elliptical velocity profile. When the blood comes up, let's say in the common carotid artery in the neck, so imagine that's like my forearm. My thumb will be like the internal carotid artery going up to the brain. My fingers are the external carotid artery because they got all the branches. Thumb is like the big one, goes up to the brain. Your blood pressure comes up the common carotid, hits the median divider, meaning the soft tissue dividing the external and internal carotid branches. It bounces off of there and causes turbulent flow. Okay, some of the flow goes backwards slowly. Those are called retrograde eddy currents. All right, well, when you have an excessive amount of this, normally it doesn't cause any problems at all, but when you have an excessive amount of turbulent flow, an excessive amount of retrograde eddy currents, it confuses the endothelium on the far wall from the median divider. And it will then shed its glycocalyx, and its glycocalyx is about 600 nanometers high, whereas its adhesive molecules like VCAM, vascular cell adhesion molecules, they're only about 60 nanometers. So once you shed the glycocalyx, VCAM is sitting right underneath, and stuff will start attaching to it. You'll start attaching white blood cells to it. You'll start forming clots of red blood cells on there. And this is where you virtually always see the initiation of an atherosclerotic plaque opposite the median divider. Okay, this is also why hypertension tends to be present. The main risk factor for atherosclerosis are hypertension and cholesterol. Everybody always says cholesterol, but they don't realize hypertension is also a major risk factor. It's the main risk factor for strokes. It's the main risk factor in the brain for all those white matter hyperintensity problems. Okay, and what I'm trying to say is usually this doesn't start turning into a problem until people have trashed their ascending thoracic aorta elastic fiber. So this is why we don't usually start seeing strokes and stuff until the patient's in their 40s, and then even more so in their 50s, and much more so 60s, 70s, and 80s. Because initially they got that good ascending thoracic aorta Windkessel effect that's giving them a good diastolic flow, a narrow pulse pressure, everything's copacetic, hunky-dory, they're okay. But they keep on pushing with these high-fat, high-sodium diets, you know, caffeine, sleep deprivation, stressed out, and their hypertension just keeps working away, trashing those elastic fibers. Then it starts to trash these bifurcation points. And it's simple, the bifurcation in the neck. Common carotid goes to external carotid and internal carotid. But there's tons of bifurcations in the heart and everywhere else. So the problem is amplified in those areas, okay? And atherosclerotic plaque, you can partially reabsorb it. You can reabsorb the acute clot. Atherosclerosis is a blood clot. It becomes organized over time as the immune system moves in to reabsorb it. You can reabsorb the fat in there, the lipid core. You can reabsorb the dead cells, the necrotic core. But you're not going to reabsorb the acellular fibrotic tissue or the calcification. Now, I know some people say you can resorb the calcification, and they claim there's a paper to that effect. I just haven't seen it in my own personal experience, which is a lot with blood vessels. So I'll believe it when I see it, you know, maybe. And then okay, so we'll leave it at that for atherosclerosis. We can talk about atherosclerosis a lot more. One of the things you get from eating plant nitrates is they're precursors to forming nitric oxide for vasodilation, which will help to lower your blood pressure in a good way. You got the bacteria in the back of the tongue that convert the nitrates, NO3 to NO2. This should be nitrite. And then the stomach acid converts them to NO, nitric oxide. This is why you'll have heard Nathan Bryan and Dr. Esselstyn talk about you don't want to be using F- toothpaste, fluoride toothpaste, because it can kill the bacteria on the back of the tongue and prevent your ability to convert this. And so it can increase your risk of hypertension and thus atherosclerosis, stroke, dementia, and all these other problems. And you got to be careful with these PPI acid inhibitors in the stomach because they can decrease the stomach acidity, lower your ability to convert the nitrites to the NO2s to NOs, okay? So that's called the exogenous pathway of nitric oxide. All right, so now I'm going to talk about something a little different. I'm going to get into the mystery of dietary sodium. Why do you hear so many doctors contradicting each other on sodium? Okay, so when God was designing the earth, okay, it looks like he started life in the water, in the ocean. And we know the ocean, salt water, okay, so there's a lot of sodium in the salt water. And then the waves crash against the rock, a lot of limestone, and that puts calcium carbonate, puts calcium into the water. So think of the seawater as having high sodium, high calcium. And if you form a membrane around seawater, you have to pump out the calcium and you have to pump out the sodium so you can be allowed to bring anything in there, because you have to have isoosmolar, the same osmotic number of molecules inside the cell, same number of charged particles inside the cell as outside the cell. Otherwise, the water would rush in, the cell would swell up, and it would burst. Okay, that's going to be very important for understanding cell physiology. That's why I went through all that. Sodium and calcium in the water, in the extracellular space. Okay, so if you look at the ion concentrations inside a cell versus outside a cell. So here's inside a cell. Because you pumped out the sodium, here's sodium, the red stuff, it's going to be very low. You actually pump in a lot of potassium. You want potassium to be high inside a cell. Okay, K comes from kalium, the Latin word for sodium. Na is for natrium, the Latin word for sodium. Okay, calcium then is incredibly low inside a cell, 100 nanomolar. Okay, literally the calcium outside the cell is 10,000 to 15,000 times higher than what's inside the cell. Okay, that's for good reason. Calcium is the boss. It's the aristocrat. Calcium, I call it, it's like the mama. Okay, there's only one mama, and she's the boss. All right. I'm going to explain what I'm talking about. I gave these ions a personality that'll help you to remember them. So here's the sodium potassium ATP pump, and this is about 1/3 the energy of a typical cell. It's 2/3 of the energy of a neuron. It's super important. It's going to establish an electrical gradient across the plasma membrane of a cell, the outer lining of a cell. Typical cell is going to have about negative 65 millivolt resting membrane potential charge. All right. So it gets that because you're pumping out more sodium, 3 positive charges for the number of potassium pumped in, 2 positive charges. All right. So you have a net negative charge inside the cell. Then what's going to happen is you've accumulated sodium outside the cell. Like we said, you always want to pump it outside the cell, which allows you to bring other things in. So you're going to have about 10 times higher sodium outside the cell than inside the cell. And that gradient, so it's electrical based on the charge, and it's a chemical concentration gradient based on the amount of sodium inside versus outside. It's higher outside. And you can couple the desire of sodium to come into that cell to pumping other things out. Okay, this is called the NACA exchanger. Na for sodium, Ka for calcium, X for exchanger. So when sodium is allowed to come in, it can spin this thing like a mill wheel or spin it like one of those rotating doors on a big office building or a big hotel or something and pump the calcium out. Okay, magnesium has to be there for an ATP reaction. I'll show you why in a moment. And this is how the cells create the effect of an electrical battery. It's like an electrical battery because you have current flow from the net positive ions flowing out. You have charge separation across a barrier. Okay, this is an electrical generator is what this membrane pump is. And now here's a key point. Almost all of the positively charged ions, the cations inside the cell, are composed of potassium and sodium. And it's a constant. That's about 98% of the ions inside a cell. And it has to always be 98%. It can't change because then it would change the osmotic concentration of particles and water would come into the cell and it would burst. Okay, so it's always going to be the same. But the relevance is that if you eat excessive amounts of dietary sodium and not enough potassium, you're going to start accumulating more sodium inside your cell, and it's going to weaken your ability to run that NACA exchanger for pumping calcium out. So you're also going to start to accumulate calcium inside the cell, and calcium is going to make the cell do things it should not do. Okay, so I'm going to talk about the personality of the ions, and trust me, if you're interested in how the human body works, you're going to sooner or later have to come to terms with ion pumps. And this little trick I'm about to teach you, I just made this up because it works, okay? Calcium is like a wife. The wife, the mama, is the boss of the house, like an aristocrat. Calcium comes into the room and says, do this, you do this, you do this, you do this. Everybody knows mama. Mama's the boss of everybody, okay? She's the center of attention. She knows everybody. She doesn't have to be reasonable. She says whatever she pleases, and she tells everybody to do something, they got to do it, okay? She comes home, she starts barking orders, they got to do it. She walks in the room, she knows everybody. Whereas the man over here, he's dressed pretty nice, but he's really sort of just a chump who pays the bills, okay? She's the boss, she's in charge. That's calcium, the aristocrat, All right. Now, here is potassium. Potassium is the good, hardworking middle class that makes everything function, okay? Makes society function. And the middle class grunt work is done by the potassium, like building the streets, running the railroads, driving the stagecoach or whatever it might be. Potassium doesn't have a lot of glamour or glory, but it's getting the work done to keep everything functioning smoothly. Remember that for potassium. It's the good middle class in a sense. All right. Now, here's magnesium. Magnesium is mellow. It's going to be called mellow because it prevents overexcitability in the brain. It blocks calcium channel in the brain, the NMDA receptor. But it's also a hero. Magnesium is strong. Magnesium is like Charlton Heston and Ben-Hur holding the horses under control in the chariot race, okay? And what magnesium does, it has a 2+ positive charge. It has to hang on to the second and the third phosphate of ADP, adenosine triphosphate. And it doesn't want to release the third phosphate until it's the proper time in the chemical reaction. If it weren't for the magnesium there to hold it together, this third phosphate would want to pop off and it would be wasted, its energy. It's used to do all kinds of important things in a cell. So magnesium makes that possible. And I also said magnesium is a guard. Just like this guard is guarding his little channel here, magnesium guards the NMDA receptor, which is a calcium channel on brain cells, all right? And it prevents calcium from getting in. So it prevents calcium overload of a neuron. If calcium overloads a neuron, it becomes overexcited. That can cause anxiety, that can cause confusion, that can cause brain fog, that can cause depression, that can cause insomnia, all bad stuff. You don't want it. Most Americans are deficient in magnesium because it comes from plants, okay? Where does magnesium come from? It's in the center of chlorophyll. Potassium is loaded up inside of cells. Magnesium is loaded up in chlorophyll. That's why you want to eat these plants to get the good stuff. If you process a food and you grind it and you process it too much, you drive away all the potassium. That's why, and then they throw sodium on them to make them taste good. That's why processed foods are high in sodium, low in potassium, okay? And they're not good for you. All right, now here is sodium. I describe sodium as being the angry poor. The angry poor on the outskirts of the city, they're pissed off and they want to get into the city. Like Les Miserables, Victor Hugo. Okay, and here they are, the famous painting, overrunning the fort of New York, the Hessian missionaries in 1776 by Don Troyan, a magnificent painting. Okay, you don't want sodium coming in the cell unless you allow it to, because it's part of getting calcium out. There's times when you got to get calcium out, okay? Now, here's how it works. You got the sodium potassium ATP pump, as we spoke about earlier. Good old potassium middle class coming in to do its job and make sure the cell functions correctly. The sodium, the angry poor, is mostly kept outside the cell. When calcium is allowed in the cell, because the cell needs to do something, whatever a cell does, calcium is what makes it happen. So if a neuron's going to release its neurotransmitter, like glutamate in this case, it's because calcium got elevated in the cell and says, release the neurotransmitter now, okay? So it'll be released. But the cell has to be able to turn itself off. Imagine you're hitting the speed bag in boxing. Pop, 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 pop. You have to make your arm go forward, back, forward, back, forward, back, forward, back. You have to do that very fast. It's all electrical. So you have to be able to turn this on and off really fast. That's why you can pump 5,000 calcium ions out in less than 1 second. It's incredible, this knockout exchanger, okay? But in order for everything to work, you have to have all these ion gradients correctly at the correct amounts. And that's how you do it, by eating a high potassium, low sodium diet. That's the secret of it all, to make these pumps work. And that's also the case for vascular smooth muscle, whether or not it contracts. If you elevate the cytoplasm calcium, it will make the cell do whatever the cell does. So a vascular cell, smooth muscle cell, it'll make it contract. And if you tonically have eaten a high dietary sodium, you'll accumulate sodium inside the cell. It's going to dissipate the electrochemical gradient, and you're going to be less effective at pumping calcium out. So the cells are going to stay tonically contracted. It's going to cause hypertension. So that's the secret of it. Okay, and so what really matters is not so much the amount of dietary salt as much as it is the ratio of how much potassium to sodium you eat. So you want to really, Richard Moore, who wrote the great book, High Blood Pressure Solution, he says you got to keep it at least 5, okay? But I really think he's underestimated. He doesn't know nutrition that well. I think you more want to keep it in the range of 10. 10 times, eat 10 times more potassium and sodium. And that's actually easy to do. Wait till you see these numbers. I'll explain it in a moment. I'm going to show you the actual numbers in a sec. Here's the K factor. So K factor is the ratio of potassium to sodium. And like I said, Richard Moore says, if you keep it 5 to 1 or better, higher, you'll probably be okay in terms of preventing hypertension. But I think it's higher. I think our ancestors probably were about 20 to 1. Richard Moore believes it was more like 16 to 20. I'll explain why in just a moment. And that kind of goes back to what do you think our ancestors really ate? All right, but the bottom line is potassium is a vasodilator, lowers your pressure. Sodium is a vasoconstrictor, narrows the artery, raises your pressure. All right, now here's the K factors. This is the amount of potassium to sodium in foods. If you look at fruits, fruits are in the ballpark of 100 to 450 more potassium than sodium. Bananas have a K factor of 450 times more potassium than sodium. That's a high K factor, okay? Here's your starches in light blue, and those tend to have K factors in the ballpark of about 20 to 60. So they're still great, okay? Then salads are more like in the ballpark of 5 to 15, okay? The greens, all right? Sweet potatoes are about 14. But you look at beef, even meat is not that bad. Ground beef is by itself, without processing, it's got a K factor of about 4. But you start processing stuff, it gets worse and worse. A soy burger is about 1.6. And remember, we want it like around 10, at a minimum of 5. Cheerios, 1.2. Special K cereal, which I used to think was a health cereal when I was a kid, 0.06. They put sodium in these things and they process out the potassium. So these are really bad for your blood pressure. Okay, that's why I never eat processed food. I'll never eat anything that has more than one ingredient in it because they can put other things as a second ingredient you don't want. Oh, okay, this was something a little funny. Do you remember Sam Kinison? He used to have a comic routine about starvation. And he joked about, these poor people starving out in the desert. And he said, don't send food, send luggage. There is no food there. He said, nothing grows here. Nothing's ever going to grow here. All right. And so what I'm trying to say is the reason there's so much hypertension in populations that live in cities and urban areas is because they eat all this processed food. There is no potassium in processed food. There's next to none. And there's never going to be. You have to stop eating the processed food. You're always going to be hypertensive. And I can tell you millions of people die every year for that reason because they don't get their potassium. So they're vasoconstricted. They're hypertensive. They get tons of problems. Walk through any dialysis unit. You're going to see a bunch of black men with hypertension and kidney failure. And like I said, nobody, without knowing this knowledge, you can't help these people. And that's why that paper is so important and awareness of this, okay? That's what it comes down to. Here's the Kempner data. He's feeding them 95% or about 94% carbohydrate, 4% protein, 2% fat. They did just fine with these really low-fat diets. Pritikin showed a bunch of people doing really well with low-fat diets, less than 1%. Now, don't get me wrong, with any naturally chosen diet, you're never going to be able to get your fat down that low. Kempner did everything he could to lower dietary fat, and he wanted to lower dietary protein too. He's trying to protect the kidneys. The main thing the kidneys do is excrete protein. So by lowering dietary protein, you protect the kidneys. And he wanted to lower sodium as much as possible. He got some sodiums down to as low as 150 milligrams per day. That's unnatural, okay? The Yanomamo, I think this is like 200 or 400, something in that ballpark, milligrams per day. All right, so anyways, I'm just telling you, this is what you could potentially do to treat hypertension. This is why the sweet potato was so great, was that it only had 4.5% of calories from protein. Regular potatoes about 8, rice is in the ballpark 7 or 8. Okay, fruits also are looking really good. They tend to be very low in fat. They also are very low in protein, high in fiber, and they're alkaline. So those are like the 2 best foods to eat. Then you need to get some extra nutrients from eating some greens. But all the animal foods are bad. They're, they don't have any carbohydrate other than milk has lactose, and they're all high in fat, high in protein. They're all bad. And here's sort of like the Spartan vegan pyramid, Basically, this is all the social stuff. Get your exercise, maintain your social relationships, sunshine, sleep. Religious people are a lot healthier. Eat the majority of your calories from starch. McDougall would say like 90% of your calories from starch, 5% from fruits, 5% from veggies. I actually eat more than that of fruits, but I'm real active, so I'm okay with it. And then the other point I want to make, I forgot to get into it. What's the difference between sodium attitude versus Kempner? Why did Kempner push so hard to get sodium down? And why did McDougall say it's not that big of a deal? And the reason is actually explainable once you understand that K factor is the key issue. Kempner was treating patients with chronic severe hypertension, systolics in the 200s. So he was desperate to do anything he could to get their pressure under control. Whereas McDougall, his patients weren't as severely hypertensive. And what he found was once you start eating the plant foods, plants are full of potassium. The potassium goes way up. You stop eating the processed food and the meat with all the sodium to preserve it and the sodium to make it taste better, your sodium goes down a lot. So he was getting great benefit. He didn't need to be as go to such a degree as Kempner did. And they both got great results. But that's why you're going to see people say, oh, you have to lower sodium this much. And McDougall also said, let people put a little salt on the outside of their food, a little sugar if they want, because it gets them to eat the plant foods. That's the most important thing. The biggest toxin in the Western diet is the excessive amounts of dietary fat and the animal foods, okay? So salt and sugar, he felt, were minor problems, minor scapegoats, and you could be okay with a little bit of those on the outer part of your food. It's much better than putting tons into the food itself, like let's say you're cooking a soup. Putting a little bit on the outside of a potato is not a big deal, but putting tons of it into the liquid while you're cooking the soup, that's a bad idea. Anyways, that's sort of the Spartan vegan pyramid diet, low-fat vegan diet with no oil, which is basically about the same thing as the Dr. McDougall diet, the Esselstyn diet, the Jeff Nelson diet. It's low-fat vegan diet with no oil. Here's eating the starch. Starches are great. They stretch your stomach early because they have low caloric density, 1 calorie per gram. Early stretching of the stomach causes early satisfaction and hunger. It takes time for the digestive enzymes to peel the fiber away from the glucose. Starch is basically a polymer of glucose wrapped in fiber. So you maintain a normal blood glucose a prolonged amount of time. You don't get any blood sludge. Here's caloric densities. Oil is the worst, 9 calories per gram. Starch is really good, 1 calorie per gram. Meat and cheese are bad. They're like 4. Nuts and seeds are 6. I think nuts and seeds are totally overrated. I recommend avoiding them. Greens, only 0.1 calorie per gram. Okay, so they're super low. They're good for losing weight because they're so low in caloric density, but you can't satisfy your hunger with them. You need starches to satisfy your hunger, and fruits. And starches are better than fruits to satisfy hunger. How fast do things come down? Your hemoglobin A1C is a measurement over the course of 3 months, because it takes red blood cells have a life of 3 months. Blood glucose can come down quite rapidly. Blood pressure can come down quite rapidly if you haven't had it that long. But if you've had it real chronically and you got calcified vessels, it's going to take a bit longer. It's good to get them off the meds pretty quick. A person has to work with their doctor, healthcare provider otherwise, because if you overtreat your blood pressure and then you change your diet, you could drop your pressure so low you just pass out. If you're driving a car, you could crash. And you don't want that. So you got to work with your healthcare provider to titrate your dosages if you're on meds. And of course, it takes more time to lose weight. And in the end, it's best to live like Adam and Eve, but keep your indoor heating and plumbing. Genesis 1:29, I have put every plant on the earth that shall be food for you. So I hope that was helpful.
That was dynamite, Peter. That was great. I took some notes. I'm going to go back and look at my notes. I couldn't keep up with you because I'm doing 10 other things here. But you started out talking about Papua New Guinea and getting 95% of their calories from carbs, sweet potatoes primarily, which are 1% of calories from fat. They're very low. You said that nobody knows what causes hypertension when you look at medical books and when you go to college. Their solution is a pill, and the pill is a poison to, help control it. But you can't poison your way to health, you said. Dr. McDougall, his threshold for what he considers high blood pressure was at 160, I think, persistently, for real, where he wasn't worried about 140 and other things like that. As I recall, you talked about the Windkessel effect, which is more likely the systolic problems, hypertension, when you lose those fibers. You talked about the Tarahumara Indians, where there's no heart disease, there's normal blood pressure. They eat an old plant-based diet, squash, corn, greens, and beans. There's no hypertension. They run, and not just a few of them. All of them can run hundreds of miles over a few days. You talked about how the Tarahumara were split into 2 tribes in the 1800s, and one tribe became the Pima in Arizona, and they adopted the American diet, whereas the Tarahumara continued eating their plant-based diet. And the Pima in Arizona are some of the most sick people on the planet. They're, obese and just have every kind of problem you can imagine, whereas the Tarahumara are still healthy. So we know it's not the genetics, and it's the food. And Pritikin designed his diet based on the Tarahumara. He observed the 80-10-10. He coined that term, 80-10-10, makeup 80% carbs, 10% protein, 10% fat. You talked about the Yanomami Indians. There's little or no sodium in their urine. They have no heart problems of any kind, a very low sodium diet. You talked about the pattern in Japan, where they're getting, 14 grams of sodium, some enormous amount every day. And there's lots of hypertension and strokes. And you talked about hypertension, damned if you do, damned if you don't, which is basically you don't want your pressure too high or too low. And that over-treating high blood pressure can be very problematic, that there's sort of a sweet spot, because either way, if you don't get enough oxygen in the brain, you're going to see strokes, mini strokes, cells dying either slowly apoptosis. You talked about the Jacques de la Torre theory and how he cut off different arteries to, test and create his theory. Hypertension leading to dementia, either from too high or too low due to medications. Blood pressure. You discuss strokes and the penumbra, the part of the brain that can be affected from a stroke, but can still survive if it gets enough oxygen. You talked about hypertensive strokes, high blood pressure. From high blood pressure, you went through different types of strokes and the holes and the bleeds and what the most common things that you see in dementia and strokes, hypertension, pre-diabetic, arteriosclerosis. This is kind of the most common characteristic of a patient. You showed us pictures with the black spots, the micro bleeds in the brains, and hypertension being almost always the cause. You talk about it's also common for many little small strokes, people with diabetes who are smoking, with over-treated hypertension. These are the common things. You talked about vasodilation and what it does, the various causes of how, let's see, anyhow, you had a whole slide on that talks about things to avoid, common things that work the wrong way. And you talked about things that open arteries, like exercise, nitric oxide, sunshine. Again, you'd have to go back and look at the slides. You've laid it all out. You got a big diagram showing all the different environmental things in food and chemicals, drugs, medicines that people are commonly exposed to that are going to mess you up. And people focused on diet need to be thinking about this too, because a lot of this stuff is in your food and in medicine you might take. People are exposing themselves to a ton of things that can be working against or inhibiting your own healing system. You talked about your own theory of dementia, which was quite interesting. You went through, I didn't take notes, but that is about balance and the supply and demand, the supply and the metabolic demands. And if you are overstimulating, it's a problem. You want to keep a high level of mitochondrial function. And there's ways to do that. Exercise, you're very high on. That's really good for your brain. You talked about fat sticking red blood cells together. You talked about the zeta potential, the negative charge that's outside of cells, and things like LDL, high LDL triglycerides, fats, oils can overcome the repulsion that's caused the negative charge so that things stick together. And endothelial cells also have a negative charge. So again, to keep things moving and not clumping, not clotting. So you went through how electrical charges, negative charges, again, cause cells not to stick together. Slippery when wet was one you said. Normal red blood cell is 7 microns. A capillary is only 5 microns. So the more clumping, the more pressure. It has to go up, has to increase in order to get that through. You talked about lack of dietary fiber. It's very important to have fiber to make tight junctions and prevent leaky gut. In leaky gut, bacterial toxins can get into your blood and cause just a whole lot of problems. Clotting, autoimmune diseases, other things. You talked about iron. Iron is like fire. It's good in your fireplace. It's good in your stove. But anywhere else, it can burn your house down. So you don't want high free iron. You don't want to be iron overloaded. You give away extra tubes of blood when you give blood because it's good for you to lower your iron. You have to push big white blood cells. You're talking about how they're comprised and pressure goes up with that. You talked about mitosis and higher meat diets and how they promote clotting. You had a big list of what makes blood thick and what predisposes you to clotting. And anything that makes your blood thicker can raise your blood pressure. Things like a high-fat meal, dehydration, leaky gut, excess free iron, being sedentary, stress, sleep deprivation, caffeine, excess salt, lack of plants in the diet is another risk factor. You talked about turbulent blood flow, excessive turbulent blood and eddies and how they form and how they can form plaques as a result because it becomes sticky, that area. Excuse me, you talked about plant nitrates, helping lower blood pressure, nitric oxide, how that works. Don't use fluoride toothpaste that inhibits making nitric oxide. You talked about dietary sodium and why are there apparent contradictions in how people view this, say between Dr. McDougall and Dr. Kempner even. You had a discussion of how potassium and sodium work together and impact mitochondrial function. And this is a major key to managing your blood pressure. So your body's an electrical generator. If you eat excessive sodium and not enough potassium, you're going to weaken your ability to make more energy, and you're going to end up with too much calcium in your cells, which is something you don't want. You went through with your little calcium is like a wife, the bossy aristocrat, not reasonable. She's powerful. Potassium is the hardworking middle class worker, the grunt work, keeping things moving, no glamour, but gets the job done. Magnesium is mellow, but also a hero. It guards the calcium channel and prevents calcium overload. Magnesium comes from plants, from chlorophyll. Sodium, you said, is the angry, pissed off, masses that want to get into the city and take over, want to overrun the city and invade. You don't want sodium coming in unrestrained. You only want it in if you allow it in order to get calcium out. You talked about the ATP pump. What a cell does, calcium, the high potassium, low sodium diet being a key to eating too much sodium. That's going to lead to weakness and hypertension. So, and that you talked about how it's not so much how much salt, but the ratio of how much sodium you consume compared to how much potassium you're eating. And that the ideal, you think, is to eat 10 times more potassium than sodium. Potassium lowers your pressure. And the K factor is how much more potassium than sodium you're eating. And you went through a list of foods with high K factors, which is desirable, like fruits and starches, and salads and greens are pretty good. Meat is, not great. And cereals and soy burgers and potato chips, anything processed is absolutely horrible. You looked at Kempner's data and how he had a super low-fat, high-carb diet like Pritikin, protected so many, body areas and parts, the kidneys, the hearts, the eyes, reversed a lot of diseases. You talked about the Spartan vegan diet and went through how it starts with the social family, aspects, the emotional ones, and then starch is a key, and fruits and veggies and B12. You discussed Kempner versus McDougall's approach on salt. McDougall said some salt is okay as long as you're not cooking, you're just putting on the outside of food. It's going to help you stick with the diet, and you're going to get enough potassium this way that we don't have to worry about that salt you're taking in. Your K ratio is going to be fine. Kempner, on the other hand, was treating really sick people. And so he just wanted the salt or the sodium to be as low as possible. But that's they both got great results, and that explains that contradiction or apparent contradiction there. So how fast does your health improve with this diet? You said different problems can take different amounts of time, but the key is live like Adam and Eve, but keep your indoor plumbing. Dr. Rogers, thank you for breaking down once again so clearly the science here, especially the importance of that K factor and how just, these understanding that and changing your diet, even in a simple way, can really make a huge impact. And I can attest that works, that K factor issue. Listen, people, thank you. If you found this presentation from Dr. Rogers helpful, be sure to check out his new book, Prevent and Reverse Hypertension. The link is in the description below. There it is. That's the beautiful book there. And if you want to help more people to discover this kind of life-changing information, please give the video a like, share it, subscribe. You know what to do. And we'll see you on the next one. Peter, thanks again. Great having you.